And now, let's proceed to the direct thrombin inhibitors. So, direct thrombin inhibitors are also known as anticoagulants because they stop or prevent the blood clot. They directly bind to the active site of thrombin factor 2A, which is active, to inhibit thrombin's downstream effects, which prevents the conversion of fibrinogen into fibrin. And they are in contrast to indirect thrombin inhibitors. Kasi pag sinabing indirect thrombin inhibitors, they bind to antithrombin and potentiate the inactivation of the factor XA and other serine proteases. In short, madami pa siyang process unlike sa direct thrombin inhibitors, which is direkta na nagbabind sa active site ng thrombin. And anticoagulants are classified as parenteral, or oral. So, hirodin, bivalirudin, argatrovan, and melagatran, these four drugs are classified into their molecular size and binding sites. Hirodin and bivalirudin are large bivalent DTIs. DTIs means direct thrombin inhibitors. Direct thrombin inhibitors. And they bind. These two bind at the catalytic or active site of thrombin. Active site of thrombin. As well as at a substrate recognition site. Substrate recognition site. While argatroban and melagatran, they are small molecules that bind only at the thrombin active site. Thrombin active site. Thrombin active site or active site of the thrombin. Hirodin and bivalirudin, they bind at the active site of thrombin and substrate recognition site, while the argatroban and melagatran, they bind at the thrombin active site or active site of thrombin. Now, let's figure out how these direct thrombin inhibitors actually work. Let's see their mechanism of action is, and to do that, we need to talk about the clotting cascade because we're talking about the clotting cascade, and the clotting cascade does is, so for example, you have a paper cut or you are bleeding. So we say that anticoagulants role is to prevent or stop the blood. So pag-usapan muna natin yung clotting cascade. So in clotting cascade, there is what we call the intrinsic pathway and the extrinsic pathway. Wherein the intrinsic pathway, the damage is in the inside, while in extrinsic pathway, the damage is on the outside. Yan. Intrinsic inside, extrinsic outside. And here in the intrinsic and extrinsic, may makikita tayo ditong mga clotting factors. Like dito sa intrinsic, merong factor 12, 11, 9, may 8, 8. Yan. Dito naman sa extrinsic, may 3, may 7. And these clotting factors activate each other. So, itong factor 12, pag na-activate, ma-activate yung factor 11. ma-activate naman yung factor 9, and so on and so forth hanggang makarating tayo or until we hit the middle, which is the median pathway. And here in the median pathway, we have the clotting factor 10. And once this clotting factor 10 is activated, ma-activate naman yung clotting factor 2. Pag na-activate yung clotting factor 2, ma-activate naman yung clotting factor 1. And it is important to know that clotting factor 1 is the whole point of a clotting cascade, because clotting factor 1 is fibrin. This one is the fibrin. 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 And this fibrin is needed to make blood clot. So here, blood clot is equal to platelets which are circulating in our blood plus the fibrin. So this is the process in the coagulation cascade. So paano nga ba nangyayari yung action ng anticoagulants? So for example, we have here the bigatran, which is a direct inhibitor drug, the bigatran. Yan, the bigatran. The bigatran are direct thrombin inhibitors. So if we have a patient, like this one here, and we dispense them the bigatran, and they take it, essentially what happens is the bigatran will block the clotting factor 2, also known as the thrombin. Ayan. Kasi sinabi natin kanina sa unang slide na anticoagulants will directly bind to the active site of thrombin. So factor 2 is what we call the thrombin. So the bigatran will bind and it will block the factor 2. So pag na-block na yung factor 2, mabablock naman yung factor 1. Yan. If the bigatran will block the factor 2, as we all known as the thrombin, then it will eventually lead to blocking the fibrin. And if we block the fibrin, we block blood clots. Yan. Pag na-block na natin yung fibrin, mabablock na rin yung blood clots. And that's exactly how this drug works. Una, i-block, mag-bind muna siya sa active site ng thrombin, which is in the factor 2, and eventually, i-block nyo na yon. Pag na-block nyo na, mabablock nyo na din yung fibrin. And pag na-block na natin yung fibrin, ma-prevent na natin yung blood clot. So here, parenteral direct thrombin inhibitors, or DTI. DTI was first isolated from the saliva of leeches. And these leeches are called medicinal leeches or Hirudum medicinalis. So, paano nga ba yun nangyari? So, from the saliva of leeches, we will be able to find thrombin inhibitor, which is the hirudin. And this hirudin is a specific irreversible thrombin inhibitor. And ang recombinant form ng hirudin is lepirudin. Lepirudin is the recombinant form of hirudin. So, pag nag-take tayo ng lepirudin, we should use it with a great precaution, lalo na sa mga patients na may renal insufficiency kasi wala itong antidote. Kaya sinabi natin ito ay irreversible. Hirudin can inactivate fibrin-bound thrombin in thrombi. and it is administered parenterally and monitored by a PTT, which means PTT stands for partial thromboplastin time, wherein it is a blood test that measures the time it takes your blood to clot. And a PTT test can be used to check for bleeding problems. Lipiridine is also used and our lipiridine is licensed for the treatment of thrombosis. It is used for the treatment of thrombosis complicating HIT. And as we said earlier, it is given parenterally as an intravenous infusion. And when we say thrombosis, it is a clot inside the blood vessel or forming of blood clot in a blood vessel, wherein this clot can block or obstruct blood flow in the affected area, as well as cause series of complications if the clot moves to a crucial part of the circulatory system such as the brain or the lungs. And lipiridine is excreted by the kidney. Yan. It is excreted by the kidney. Lipiridine production was Lipiridine production was discontinued by the manufacturer in 2012 kasi up to 40% Kasi up to 40% of patients treated with lipiridine has been reported to have formation of anti-hirudine antibodies. Anti-hirudine. Anti-hirudine. Antibodies. And these antibodies are called immuno immunogenic immuno immunogenic hala yan, complexes. Yan. These anti-hirudine antibodies is called immunogenic complexes. And these immunogenic complexes may delay the renal excretion of lipiridine and can cause drug accumulations. So, ang nangyari imbis na anticoagulant lang, nagkaroon or naging enhanced anticoagulant yung effect. And yung mga na-expose dito is nagkaroon ng life-threatening anaphylactic reactions, which is a serious allergic response that often involves swelling, hives, lowered blood pressure, and in severe case, shock. And we must remember that there is no specific antidote to reverse the effect of the recombinant hirudine. There is no specific antidote to reverse the effect of the recombinant of hirudine, which is the lipiridine. Now let's go to bivalirudine. Bivalirudine. So bivalirudine is a bivalent inhibitor of thrombin. And unlike hirudine, the binding of bivalirudine is reversible. Reversible naman siya. Because plasma enzymes, including thrombin itself, cleave the arginine proline bind at the catalytic site. Bivalirudine is administered intravenously and has an immediate onset of action with therapeutic activating clotting times or ECT that can be achieved within 5 minutes after the initiating therapy. And they have a short half-life. So when we administer bivalirudine, the 20% the 20% of the dose is renally eliminated, and those adjustments are necessary in patients with moderate renal insufficiency. So, i-adjust natin yung dose ng bivalirudin if the patient has a moderate renal insufficiency. Because bivalirudin is contraindicated or can contraindicate with patients with severe renal impairment. Ito, mako-contraindicate niya yung mga patient na may severe renal impairment. It is also used in percutaneous coronary angioplasty or PCI, wherein this PCI, at sinabi natin PCI, it is a procedure used to open clogged heart arteries, wherein a tiny balloon catheter was inserted in a blocked blood vessel to help widen it and improve blood flow to your heart. So, in patients with coronary artery disease undergoing coronary angioplasty who receive vivalirudin, the activated clotting time or ACT should be closely monitored because the activated clotting time increases in patients who are infused with bivalirudin. So, Argatroban is used in patients with heat with or without thrombosis or during percutaneous intervention or coronary angioplasty in patients with heat. And because it has a short half-life and its predictable dose-dependent therapeutic response, that's why it needs to be monitored by a PTT. And as we said earlier, a PTT tests or a PTT stands for partial thromboplastin time, wherein it is a blood test that measures the time it takes your blood to clot. And a PTT test can be used to check for bleeding problems. Also, argatroban is given by continuous intravenous infusion, because essentially we're monitoring the patient to see their platelets come back up, and then we adjust accordingly, because as argatroban is hepatically metabolized and predominantly excreted through the biliary system. So na-excrete siya through the biliary system. Those adjustments are necessary in patients with hepatic. So, pag yung patients who are hepatic, kailangan nating i-adjust yung dose adjustment sa mga hepatic patients lang, but not in renal impairment. So, argatroban yung dose, i-adjust lang natin pag hepatic yung patient, but not in renal impairment. So, dito naman tayo sa oral direct thrombin inhibitors or the DOACs. DOACs stands for direct oral anticoagulants drug. Direct oral anticoagulant drugs. And it has two advantages, which is the predictable pharmacokinetics and bioavailability, which allow to fix dosing and predictable pharmacokinetics and bioavailability, which allow for fixed dosing and predictable anticoagulant response and make routine coagulation monitoring unnecessary. And also, oral direct thrombin inhibitors are similar to the direct oral anti-XA drugs, which means the rapid onset and offset of action of these agents allows them for immediate anticoagulations. So, the bigatron ethoxylate mesylate is the only oral direct thrombin inhibitor that is approved by the FDA. and it is used for the reduction in risk of stroke, systemic embolism with non-valvular atrial fibrillation, and reduction the risk of recurrent VTE and VTE prophylaxis following hip or knee replacement surgery. So for pulmonary embolism or systemic embolism, this is a blood clot traveling to the lungs, and this is a very serious condition. And same thing, we have a prophylaxis dose, meaning they don't have it yet, but they are at risk, or the treatment dose, meaning they have the blood clot right now, and we need to treat them right now. And we could also use these drugs after surgery, or if a patient has a knee replacement surgery or a hip replacement surgery. We could prescribe these drugs so as they are recovering, a blood clot doesn't occur because of the stress of a surgery could have on a body. Pharmacology. So, after oral administration of the prodrug, the bigatran ethoxylate mesylate is converted to the bigatran. And after absorption, a rapid distribution phase occurs followed by a prolonged elimination time, wherein the absolute bioavailability of the bigatran after oral absorption is 3 to 7%, and it is dependent of the dose of the prodrug, wherein in normal volunteers also the bigatran is a substrate for a pig glycoprotein efflux pump. Ketoconazole is a P-glycoprotein. Ketoconazole is a P-glycoprotein, which means we should be avoided it in patients with impaired renal function because it can contraindicate the use of the bigatran. And it has a and its half-life, the mean plasma terminal half-life of the bigatran in normal volunteers is 12 to 17 hours in independent dosing, and accordingly steady state concentrations are attained within 3 days. 3 days. 3 days with multiple dosing and without evidence of significant accumulation. Now let's talk about the dosing. Now let's talk about the dosing. Let's start with the bigatran, or let's start with the bigatran, and the brand name is Pradaxa. And here we have to be mindful of creatinine clearance. So we should know how well our patient's kidneys are working. So for the bigatran, if a patient has AFib, we give them a 150 milligrams capsule twice a day. If they have a deep deep vein thrombosis or pulmonary embolism, same thing. We give them 150 milligrams capsules twice a day. Now, if we want to do prophylaxis of DVT, we give them, ay, now if we have to do prophylaxis of a DVT, meaning they don't have a blood clot, but they are at risk, and let's say it's after surgery, then we drop them down to 110 milligrams within the first 4 hours post surgery, and then we give them 220 milligrams once daily for 10 to 14 days depending on the type of surgery. We said that the kidney function is important, so if patient's creatinine clearance is more than 50 milliliter per minute, there is no adjustment. But if the creatinine clearance is between 15 and 30 milliliter per minute, we have to drop it down. So instead of 150 milligrams twice a day, it drops down to 75 milligrams twice a day. So now when we look at argatrobands, it's a little different because it's a weight-based dosing. And remember, we use this for heparin-induced thrombocytopenia or HIT. And the way it works is we have an initial dose of 2 micrograms per kilogram per minute, and it's a continuous infusion wherein it is essentially for monitoring the patients to see if their platelets come back so we can adjust it accordingly. Assessment of drug and reversal of antithrombin drug effect. So as with any coagulant drug, the primary toxicity of the bigatran is bleeding. ECT is another clotting test based on the use of protein isolated from a viper venom. So para ma-reverse natin yung effect ng anticoagulant, kailangan natin ng idarucizumab. Idarucizumab. And this is a humanized monoclonal antibody Fab fragment. This one, ito yung nagbabind sa dabigatran. Tapos pag nabind na siya sa dabigatran, i-reverse niya na yung anticoagulant effect. And this drug is approved for use in situations requiring emergency surgery or for life-threatening bleeding. And the recommended dose is 5 grams, which will be given intravenously. And if bleeding reoccurs, a second dose may be given. And this drug is primarily excreted by the kidneys. And its half-life in patients with normal renal function is approximately 1 hour. So that would be all for the direct thrombin inhibitors. In the next video, we will be discussing the basic pharmacology of fibrolytic drugs.